All right. So David, I appreciate so much you taking the time out to connect with me so that we can give this information to the next generation of consultants in this pilot program that we've started in terms of what they can expect, some of the things that you would like us to be able to cover. And so we had the standards committee had come up with this sheet in the brain spotting consultants report that goes along with the application and their 50 sessions when they're certifying people in brain spotting.
Mhm.
And so I was hoping that we could cover here like what your expectations are, your ideas are, so that we can be very clear on what we would cover with potential brain spotters on their certification.
Mhm.
So
Yeah. Well, first of all, the role of consultant is really being codified now and expanded now in a way that we haven't had it before. It's been really, unfortunately, informal to this point, and we're in the process of formalizing it, which is an important step forward. Also, we have very clearly identified roles for trainers, brain spotting trainers, and we have a trainer training program that I run, and then helped out with almost apprenticeship with the current trainers for those who are in training. So this is really adding a new dimension to our educational or didactic process for brain spotting. And so the role of the consultant is really is very important, but is going to be much more important as we move ahead. And that's where. Are you there?
yep, I'm here.
Okay, I just got a pop-up thing here that just kind of
Okay.
screwed up everything for me. Um, uh, okay, here we go.
I'm
So,
here.
um, so what can happen will happen. Uh,
Yes.
so anyhow, the role of the consultant is going to become more and more important as we move ahead, but really, what the qualifications are for a consultant, what a consultant has to do. This is what we're doing now, and I really appreciate, Sheree, you're focusing me and all of us in on this. I have been developing in the last 2 years really the nature of what goes on in consultation. Before that, again, we didn't have any specific guidelines,
Right.
and these guidelines have been in this consultant's report, this sheet that you have here that you've developed, which is extremely helpful and extremely comprehensive, and every consultant is going to need to know it and understand it inside out, because what we have found is that everybody has gaps in their brain spotting knowledge, and even our trainers, who've really just expanded and intensified their knowledge, will still have a few gaps here and there. But consultants, you can be an expert brain spotting therapist, but it doesn't make you an expert on supervising, consulting, or teaching brain spotting. So what we're looking for with the consultants is to identify your gaps, which doesn't mean there's anything wrong. It just means that brain spotting is such a multimodal, complex, interwoven modality that you can't possibly know all these things. What we find is that when people come to us for consultation, that even though they know certain areas very well, even though they're having great effect with brain spotting, there are significant gaps. And one of the key things in what a consultant does with the 5 sessions, and it may ultimately expand to 7 sessions of consultation, is to methodically identify the gaps, both in theory and technique, and be able to teach and reteach and expand the consultee's knowledge base.
Great. So the 2 areas that we have on our sheet here is theory and technique. And so I thought we might start with theory and just go down the list and talk about your perspective on each of the aspects of theory that you want to make sure that we cover.
Okay, before I do that, I want to just outline the 5 sessions right now quickly.
Okay, we've got that at the bottom down here.
Right, okay.
Okay, there you go.
Let's see, go further down. Okay, now
That's,
you have six. You have it set up with six here.
yeah, that's interesting. I did not notice that that was on six. Maybe we had,
Well,
maybe
we
we,
had kind of, yeah, but we're talking about five right now, so I'm going to fold it together.
okay.
But I really want to start with this because uh, uh, um, this sets up the theory and the practice. Um, in the first session of consultation, basically the most important thing to do is to ascertain and assess the basic, the basic knowledge. And this really goes up, this will go up to the theory and the technique up there. But to identify areas of strength and also areas of weakness and gaps. And I guarantee you, you will be surprised how many areas of gaps there are. You'll have some people who've been doing brain spotting for 3 years and are fantastic in it, and they won't fully understand gaze spotting, or they may not be using bilateral sound. That they may not have a good. They literally may not be able to articulate what the uncertainty principle is. So the first session is to be able to go over with the consultant. Of course, you have to establish some beginning rapport and give them some sense of what's going to happen, but to really go through very carefully all these different aspects of theory and practice, because that which they don't know, they're going to need to learn, and you will both teach them, and they need to go back and study my book and study the training material, the manuals, and so on. But also you're going to in session 2, you're going to need to come back to it to see do a much more a quicker, maybe cursory review, but basically to see whether they now know what they didn't know in session 1. That's the absolutely most crucial thing. It's not a bad idea to ask a student what they feel their areas of strength or weakness are, what they feel they need to learn out of the process. So this is going to be a co-participation, even though you're going to be in charge of it. So really, that's the first session, to identify all these things. And again, the number one thing you need to learn is that your consultees will not know as much as you think they do, and they will have some shocking areas of gaps. And it doesn't say anything about their intelligence, their knowledge base, or their motivation. This is just what we know, and it's probably lesson 1 is becoming a consultant, to know this, because if you don't really know this, you won't even look for it, and you won't even find the gaps. But this sheet that's set up here which is great, will allow you to be able to go through it, methodically. And of course, you see there's all like checkpoints here. In that first session, you may put next to it, I don't know about a check or an X. This is for you. This is not for them.
Right.
But to be able to use the line next to it to identify just those areas where they really have it, or the areas where they're unclear on it, or the areas where they're weak or just missing it, so that you can come back to that in the second session to make sure that they have gotten it. Now, not every student's going to come back and will get everything that they didn't get in the first session, but they should have most of it, and that which they still don't have, you can clarify, and hopefully that will be all they need. But this is where you're going to find out the consultees who may end up really needing more than 5 sessions, or 7 sessions, 6 or 7 if we ultimately go to that. Because if they're really weak the first session and then they come back and they're still weak the second session, the likelihood that when you get into clinical case material is that that's not going to be enough, that by the time you hit session 4 or the final 5th one, that they're going to really be ready to qualify for certification. So that's one of the things to look for in session 1 and session 2. Session 2, I'm going to go by what's here. Okay, we actually need to this has to be upgraded, this part, the 1 through 5, where it says 6,
Sure.
because essentially what we're looking for in the first session is a real exploration and review of the basics. You're likely not going to get into clinical case material in this first session, and the second session is not you're not going to just jump into clinical material. You're going to do a review from the first session. But all of these things, dual attunement, weight, use of session, and the use of session, giving case examples, is more what we start on with session 2. But it's really the review session. Session 2 is the review, and I wouldn't even put focus on dual attunement. Well, actually, forget that. I'm always my brain is a work in progress, so I'm thinking about this. It does, that dual attunement and weight does flow into and uncertainty does flow into case material. Mm-hmm. The supervisor, I'm old school. We used to call it supervision and supervisee, as opposed to consultation and consultee, which is more based on legal issues.
Right.
Your students should come prepared to the set with case material, and it can just be one case. Okay, we're not looking for them to present 5 cases. Mm-hmm. Basically, one case. If they want to write process notes on this or give you something in advance, they can do that, but I don't think it's necessary. That may take more time for them, for you, and for what we have for this. But they need to be able to verbally present a case. Mm-hmm. And it's got to be a case not just where that shows that they have it all right, and it's not going to be a case where they have no idea what they're doing, but a case where they have some learning needs that they're going to be presenting. Actually, any case they present, you will review with them step by step what happened, how it started, what the first session was like. They first, started doing brain spotting, and what type of brain spotting. So you're really going to do the first case material. You're going to as session 2. You're going to review the whether they have strength in those areas that they were weak in from session 1, and then you're going to go into your first case material. Again, when you have moving over to session 3, going from dysregulation to regulation is what you review in phase 1. It's one of the crucial issues that's easy for a consultee to be weak on that. Mm-hmm. And also the psychoeducation of the brain. Again, this is I really look towards more session 3. You're really getting is primarily case material again. You can continue on the first case, or there are advantages to having them present a second case, an additional case than the one they did in the second one. But again, we're not, looking. It's really sessions 2, 3, and 4 are the ongoing case material review, and you're looking at process. From this, it's not theory and technique as codified in our list here. This is really just really listening to them as far as them talking about the client, giving some kind of diagnostic sense, giving a sense of how they set and held the dual attunement frame, and most of all, looking at the focused mindfulness, the processing that happens inside of the frame, and really the nature of where the process went, the consultee's perspective on it, and really where it went in terms of the resolution of the session. SUD started at what and ended at what, the nature of the body experience, what happened with that, the emotions, thinking processes, all of this. Again, we're looking more for in 2, 3, and 4 case presentation and setup, process, resolution, all of these issues. Mm-hmm. Now, of course, things are going to come up from the theory and practice list all the time, because that's why it's there, because it articulates what goes on in the setup and the process and the finishing of the session. But session 4 is really, in addition to doing the case material, is where you review where they are at. You review with them, and you have to have it clear in your own mind, but you're going to review where they started. You're going to review with them the sessions 2 and 3, and this is your last chance to say to them, this is an area of weakness for you. You need to review it, whether it's theory or practice, theory or technique, or whether it's really how they're handling the process, how they're understanding the nature and the process of what we do. And in session 4, if you have any serious doubts about whether they will be able to qualify after session 5, by session 5 and after session 5, you should know this at this point, and you should reflect that to them at this point. You don't want to so-called drop the bomb on them in the final session. It should not be a surprise if there are problems there. And for the most part, we then give them a recommendation. Either they pass, and of course they have to meet all the other things with the 50 sessions, the write-up, paying for certification, and so on. But if not, it can't come to them as a surprise, a bolt from the blue in session 5. And we have to be able to give them some sense of why we think that they are not ready, and what they need to do in order to get ready. This will entail, for the most part, having at least 1, 2, or 3 more sessions of consultation with you, or it could be somebody else. But you have to be able to clearly articulate what the problems are, the learning needs, and how they can go about remediating them. If the consultee doesn't like what you're saying, this is their chance to have their say. One thing I really want to avoid is having consultants be so strict and demanding that they will not pass somebody who somebody else would pass. Okay, I don't want it to be that after 5 sessions with a consultant who says you're not ready or clearly not ready, they go and they do 1 session with another consultant, and the person says, "Oh, they're fine. There's no problem."
Right.
So if you are overly strict or demanding, I would rather have you be more open and being more generous as far as giving a person a break. Like if it's borderline whether they pass or not, then they probably should pass. It's only if they clearly are not ready. But one more factor that's really important with this is that we're not telling a person, if we think that they're not ready, we're not telling them that they can't practice brain spotting. Even if we think they're not qualified, we can't tell them that they can't practice brain spotting. It just means that they will not get certification now or perhaps at any point. But this is not a license to practice, okay? This is a qualification that people meet, okay? So just remember, if you say, I really don't think you're ready, I think you need at least, you can't even say how many more sessions, but a number of more sessions, I would be happy to do them with you and really focus in on that which you need to do to finish certification. Or you can go to somebody else, or you can just keep practicing, I'm going to kick this back to you, Cherie, just on your thoughts about that.
Yeah, I so appreciate us doing this, because this gives me even more clarity on, I've done a lot of what you've said, but I can see where I can do more. My one question for you is what you think of the idea. Like what I typically do on the last session with them is we clean up anything or discuss anything that we haven't been able to get to, and then approximately about the last half hour of the last session, what I do is I have them do a setup on me, and so that I can see how they do their setups and then check in with their level of attunement. And I was wondering what you thought of that.
I think it's great. I'm not quite sure that the last half hour of session 5 is the best time for that.
Okay.
Because what if you think that they're pretty qualified and then they blow that piece?
Yeah.
That might be better to, you know what, I've never even thought about that, but that might be better to put in session 4.
Okay.
I wouldn't necessarily give it a half an hour because, you know, we have a lot to do. It could be maybe 20 minutes. But I would say that would be, because that's one of the key ways of getting clarity on if they're missing something.
Right.
And also to be able to help correct it.
Right. Okay. So you already kind of said in session 2 to focus on uncertainty, and you didn't say staying in the tail of the comment, but I could move 5 up to 2.
Oh yeah, definitely that should be in 2.
Okay.
But remember, the first session, the first we'll call it session, is really more informational.
Right.
I mean, if the person just really knows everything they need to do and they're ready to go, you can go into case material. And even if they're not prepared to present a case, you can just ask them to talk about a case, and that's fine. But the nature of the focus on dual attunement, waiting, uncertainty, and staying in the tail of the comet, we want to be able to do in session 2 in relation to case material. Okay, instead of talking about it, you know, theoretically, we want to be able to flow that right into the first case presentation.
Okay.
That's assuming that in your review you find out that they've clarified and solidified enough of what they've needed to in that in the first session and afterwards.
Okay.
And what's interesting, and I don't want to intimidate anybody, I just want to really clarify the reality of things. Most people who want to become consultants really have significant gaps in things that people need for certification.
Right.
And this is what we want to focus on in terms of preparing people who are really ready to become consultants, is to find your gaps. First, we have to find your gaps in terms of being able to know it and articulate it. Then we have to find the gaps in being able to teach it. You have to know something a lot better to teach it than to do it.
Mm-hmm. Okay. And then would you say session 5 would be kind of like the wrap up, going over anything that you missed?
No.
What would you say?
That would be an element of it.
Okay.
It would be a review of the entire consultation process. And I would hopefully I would have more case material. Okay, if basically the person is ready to pass, this is a chance to have them do one more case.
Okay.
It could be, and put this in parentheses, it could be something more specific, a specific aspect of brain spotting, like addictions or child work or something, or it could relate to performance, creativity, or expansion.
And
Or
what about any parts work?
Yeah, absolutely.
Okay.
But by the way, the consultant has to be knowledgeable enough in parts work not to be able to teach it.
Right.
It's one thing to do it, it's another thing to teach it. And that's really what everybody listening to this, this is the main point I'm stressing. Just because you could do it well or great doesn't mean you know how to teach it. Doesn't mean you know enough to teach it. Mm-hmm. That's a bit of a quantum leap, and I don't want anybody to be intimidated by that, but I want people to be challenged by that.
Mm-hmm. Yeah. So, I mean, this is, again, we're reviewing where our gaps might be so that we can fill in those gaps, so that, again, we're evolving in our practice and getting better at what we do.
In that context, I always say I'm the #1 student of brain spotting. In other
Right.
words, I'm learning and growing and studying all the time. And my trainers, all of my trainers around the world, now we have 55 plus 10 more trainers in training. They're the #2 students of brain spotting, because all of the trainers are learning and growing and studying all the time. And we want our consultants to be the #3, students of brain spotting. So the learning that goes on has to be more for us ultimately than for our consultees.
Great.
So
Okay.
just to do a fast review here, then we're going to go up to theory and technique. I don't know if it, by the way, I might change that to theory and practice. I don't do that right away. It's something we need to think about.
Okay.
And probably by the end of this, I might change my mind on that. So,
Yeah, I kind of like the idea of practice too instead of technique. I don't like the word technique so much.
yeah. So let's see at the end of this where we want to go with this. So you have
Okay.
five sessions. Person comes to you, they want certification. They even need to have some sense of what certification is. Just a brief digression on this. Certification in most people's mind is something that shows that they have an expertise. It's something they can bring out to the world. In some countries, it actually, or maybe some states, it actually has some merit in terms of licensing boards or insurance companies or things like that. But in brain spotting, like everything else in brain spotting, we're not looking at the end result or the outside of it. We're looking at the process. Okay, so for us, certification is less about the certification that you get at the end and more about the process of these 5 sessions by which you learn and study and review and grow, so that at the end, when you get your certification, you're coming out of it at a much higher level than you went into it. It's the learning you get from the process of going for certification. That's the most important thing about the process, about certification in brain spotting. I'll just kick that back to you for any thoughts you have on that.
No, I would certainly agree. It gives you an opportunity to have a one-on-one experience, ask any questions that you weren't able to ask. It exposes you to things on a deeper level than what you were able to be exposed to or take in during the training.
Right.
Yeah.
That's very important. Because this, apropos of what you're saying, Cherie, this is individualized. And you come out, we don't have any tests when you come out of the phase 1 or phase 2. And even if we did, it wouldn't be the same as what you get in a one-on-one consultation format. But when someone goes, chooses a consultant and starts with them, going into it, they really don't know what it's going to be. They just know it's 5 sessions. They will not really understand this is a chance for you to really upgrade your expertise as a brain spotting clinician. So with that's the spirit and the ethos that we want to bring to our consultees. This is for you, for your development. And the certification you get at the end will be because of what you have invested in this process and what you've gotten out of this process.
Yeah, and I really want the consultants that are becoming consultants to also know that this is also for their personal growth and a sense of evolving their expertise as well.
We always learn as we teach.
Right, for sure.
I just came out of one intensive here in New York. I'm going into another one in Amsterdam. It starts on Wednesday. I come out of each intensive ahead of where I went into it. That's what I learned from teaching. Let's go up to we'll scroll back up there.
There you go.
Okay. So let's change the technique to practice.
Yeah, let's see here. There we go. All right.
And this list is going to evolve as we go through this. because there are some things that are on the practice side that are really part of the theory side, like the three legs. It
Mm-hmm.
is it's practical, but it's theoretical. So let me just see. Okay, let's start on the theory side, and we can go through this. I'm not going to talk about it now like I was doing a training, but I'm just going to talk about its place in the consultation process. And in that first session, now again, this may because there's a lot here. This may some of that you're finding out where the consultee is at may flow over into session number 2. And if it needs to, that's fine. You take the time that you need. The basic credo of brain spotting is where you look affects how you feel. And in that context, the consultee needs to be able to articulate what this is and what this means, which is essentially if you look to your left or you look to your right, while you're activated around something, it feels different. And because of that difference in how we feel based on where we look, we can get access to whether it's the access to where the greater activation is in where we look, or the access to where the greater resource is from where we look. So the consultee needs to understand what this means and needs to be able to articulate what this means.
Yeah. And to your point, David, about, like you'll be shocked maybe potentially about where people are at. This is like one of the first things that we cover. And that usually you can kind of tell where, you don't want to make an assumption, but if they can't answer that, then, we are going to have to go a little bit deeper and gain some clarity, because there have been consultees I've worked with where they can't answer that. And that's like on the very first slide of phase 1.
Yeah. But as basic as it is, it's complex at the same time. And that's why we understand. It doesn't mean if somebody can't articulate this, that there's really something wrong about their knowledge base or their learning processes. It might be, but not necessarily. But basically, you go through this with them till they can say back to you what it means where you look affects how you feel.
Okay.
And this is a line that we use with our clients, especially when they start off. They say, what is brain spotting? And, when clients ask me that, even though I'm the developer, I'll say, well, actually, where you look affects how you feel, and then I'll explain it. So you have to be able to understand it and know how to explain it. The uncertainty principle, and interesting, you have the no assumption model. It's the no assumptions model, with an S at the end there. When I was developing natural flow EMDR, I called it the no assumptions model. It was ultimately the uncertainty principle, which goes more with the brain spotting, with the entirety of brain spotting. But just why that's there, that's part of the history of how I developed this. But for the most part, we call it the uncertainty principle. And here, people need to, and they may not know this, even though they heard this in the training. The uncertainty principle is based on the essentially infinite nature of the brain, of having between 1 to 4 quadrillion synaptic connections. Okay, so the uncertainty principle, which is a sort of a theory base and a really philosophical base, is a neurobiological base. Okay, and our consultees need to know that. And also, and this is taken to a higher level, uncertainty leads to attunement.
Yes.
And certainty tends to block attunement. Okay. And I would say a majority of our consultees in the first session will not know this, okay? Because it's a subtlety or a higher learning point.
Yeah.
And also, when you talk about uncertainty, you need to talk about certainty. What's the difference between uncertainty and certainty? Certainty is thinking that you can know something that you can't possibly know. Now, that may have to do with what is popping in your head as far as when the client is saying something, what they mean, when you can't really know what they mean, or when the process goes from A to B to C, you have an idea, that's why it's happening when you can't know. But also, most therapists before brain spotting were taught other modalities, especially going back to graduate school, PhD psych programs and
Mhm.
MSW programs, most were taught models that were at least in part certainty models, and some of them were complete certainty models. So
Mhm.
the transition over to uncertainty means to be able to identify how you have been trained and even inculcated in certainty,
Mhm.
which means knowing that you have to know. And I always say this, bring it up here, that we have been taught you have to take an extensive history, which will lead you to the accurate diagnosis, which will lead you to the effective treatment plan.
Mhm.
Okay, that's the basis of psychotherapy as taught in the United States and I think around most of the world, and that is
Right.
a certainty model.
Mhm.
Okay, now from there, the dual attunement frame, we're putting together a variety of different things when we say dual attunement frame. Dual attunement means relational attunement, focus, relational attunement with the neurobiological attunement superimposed on it to help focus it and make it more accurate and deeper. We're also saying the frame here, which is really a kind of a separate concept, although I don't think we have to separate this out here. But you go to, you say below relational and neurobiological. So you really have to be able to know and cover the nature of the dual attunement frame. Okay, the two sections below you have where it says relational and neurobiological, but you got to get into frame here. Okay, um, and essentially the frame is all we have in the face of uncertainty. Okay, and the frame is neurobiological also because we're holding it not around the person's entire system, experiential and neurobiological, but we're holding it around a part of them. This is the activation, this is the body awareness, this is that eye position that they go to, creates a frame which again, as we get advanced, we have to deconstruct this before we can reconstruct this. But that frame allows processing to happen that wouldn't happen otherwise.
Mhm.
Okay, so and I expect your students to be unclear with the concept of a frame and to struggle with it. So even if they get the relational and the neurobiological, um, they won't necessarily understand how it constitutes a frame.
Mhm.
Um, when you go to the relational, I mean, this is on the one hand, this is the core of all psychotherapies. This is what research has found is the most healing aspect of every psychotherapy across the board. But relational in the context of uncertainty, which means relational means attuned presence. We have a slide and we also put on that witnessing, being empathy, witnessing, empathy. Um, I forget the last one, but uh, it is the relational works, the relational heals because of the attuned presence that's entailed in it.
Mhm.
And the neurobiological goes to, a lot of people are not going to know what's the neurobiological frame because it's not all that clear. That's a brain spotting concept and term. The neurobiological frame is is when the person is activated around an issue. The first part is body awareness. It's being aware of where the person is feeling the activation in their body. And then the second part is finding the eye position that correlates with that eye position. Okay, so when we say neurobiological, that's specifically from the body activation and the awareness of it to the eye position that matches it. That's
Does
what
that make,
yeah.
does that make sense that I changed it right there, or I put parentheses there, body awareness and eye position? Does that,
Yes.
okay.
Okay. Um, Again, I guarantee you most of our people who are becoming consultants will not be able to articulate this the way that I just did, and there's nothing wrong with them
Mhm.
doing that. But I'm just identifying the learning needs of consultants, let alone their capacity to communicate this to consultees.
Right,
Uh,
right.
I would say 90%. of the consultees in their first session will not be able to explain the neurobiological. And they'll be able to be in the ballpark around the relational attunement, but even with the lack of clarity there, and there's nothing deficient about them with this. This is what the consultation is about. It's to help them to, now that they've been out there doing it, now when you talk about this, they have a frame of reference that they didn't have when they came to a phase 1 training.
Yeah, so neurobiological as well, like would we put anything on there about the reflexes?
No, you see, eye position goes to reflexes, it goes to, which is outside window, it goes to the intuitive way that the eyes move when they're focused on something, which is the gaze spotting, and so that really goes over to the practice side. Those 3 things.
It covers it. Okay.
Yeah. Now, you should put next to tail of the comet in brackets, focused mindfulness. Dash processing.
Okay.
Okay.
Mm-hmm.
Now, this is the metaphor for brain spotting, and essentially it goes along with everything that we've talked about so far on the theory side. The tail of the comet means that attunement of the therapist to the process of the client entails following them wherever they go, uncritically, without any judgment, and understanding that is uncertainty. If you think that you can know something that you can't know, it takes you out of the tail of the comet. It may even place you as the head of the comet, which means that you're leading the process, that the client's system is not leading the process. Mm-hmm. But also, very important aspect of tail of the comet, and some of the consultees will not know this, is that we don't get into the tail of the comet and stay at the tail of the comet. That's ideal and that's hypothetical. We work our way into the tail of the comet, and then we are aware that we will always be falling out of the tail of the comet or losing attunement. And when that happens, it's more important for us to be aware of that than anything else when we're losing attunement or falling out of the tail, so that we can work our way back into the tail. And this is an ongoing process that goes like this, in and out, in and out, tail. Also, what is the main thing that causes us to fall out of the tail of the comet? It is limbic countertransference. Okay, limbic countertransference is primarily unconscious. That's why we fall out of the tail. We don't even know that we're falling out or why we're falling out of the tail. So that's part of when we recognize we're falling out of the tail, to work our way back in, is to get some idea of, well, what is it about the process that has triggered us limbically? Okay. Now that gets down to, we already with tail of the comet, I've already gone to staying in the tail of the comet, and limbic countertransference. But you might put in brackets next to staying in the tail of the comet is falling out of the tail of the comet, falling out of the tail. Okay, which then leads to limbic countertransference. What's the most important thing to know about limbic countertransference? It's natural, it's inevitable, it's ubiquitous. Okay. Again, most consultants will not know this. You see how much there is to teaching the consultants for their knowledge base to be able to understand and teach this to the consultees, who will probably have little or no idea what this is about. Okay. And limbic countertransference, there's 2 types. I don't know if you have to put this down here necessarily. You can think about that. There's just the fact of secondary exposure to the trauma of the clients and the abuse of the clients, if that's the case. but it's also when our own issues are touched on or triggered.
Right.
So there's being triggered just because of the exposure, and there's being triggered because it touches on our own vulnerability.
Mm-hmm.
But here, you know, you can really talk about limbic countertransference and understand it without understanding why I've given the term, I've labeled it limbic countertransference. So this is something that consultants really need to know. It's the idea that the limbic system, which has many different functions, why the limbic system takes us into flight first, fight second, and freeze last. That exposure to the material will create a sense of danger in our limbic system.
Mm-hmm.
Okay, which will kick us inevitably into flight and into fight and into freeze. And in this, the consultant needs to be able to identify examples or teach examples of what the flight response is in limbic countertransference, what the fight response is, and what the freeze response is.
Mm-hmm.
Okay.
Okay. Mm-hmm.
Brain spotting as a resource model. Well, this goes over to the practice side as well. So we may have to sort of be mindful of how we teach this, how we evaluate and teach this in theory, and then how we go over to practice with this. But this part, there's two parts to this. One is how and when we use brain spotting as a resource, as a specific resource model, and the second part is really how we do it, who we do it with, and how we do it. But the main thing here, and this goes to a slide on day 3, is that brain spotting is a resource model.
Right.
That being able to sit in uncertainty, being able to set and hold a dual attunement frame, being able to follow the client wherever they go, being aware of limbic countertransference, taking you out of the tail and working your way back in, that is a resource.
Mm-hmm.
That is why brain spotting is a resource model, and every consultant needs to be able to know that and to be able to articulate and teach that.
Mm-hmm. Another way that I say that, David, I would like your input on that when I'm talking with consultees, is that I say all that what you just said, but I also say that brain spotting itself is a resource model because it can help the client's own system find what was lost.
Mm-hmm. Well, that comes from the dual attunement frame. Mm-hmm. That comes, the neurobiological is particularly effective and necessary in being able to find what was lost or dissociated.
Yeah.
Okay, so that does really go along with that.
Mm-hmm.
So again, when we go now, once we've talked about that, brain spotting is a resource model, then we go to the more specific types, which is the activation model and the resource model. Again, right. we have to say that the activation model gains access to the activation, gains focused access to it. You put that down here. Yeah, put after model, just make sure you got a space there. And the resource model gains focused access to the resource. Now remember, we have to review the activation model is a resource model. Why? Because if you get focused access to something, and then it's able to heal in a way that it wouldn't otherwise, that's a resource.
Right.
The focus plus the containment of the frame in the activation model provides a resource for the client.
Mm-hmm.
Okay, and basically the resource model, and we get over to this I think on the right, is in practice it accesses it is built upon the body resource.
Mm-hmm.
Okay, it's the spot that aligns itself to the body resource.
Do you want me to put that in here?
Yeah, yeah.
Aligned to body resource or built upon?
Um, built upon is, I guess, better.
Yeah. There we go.
Okay. Now, here in the supervision, in the consultation, you have to be able, you have to know, and you have to be able to identify with the person when to use the activation model, when to use the resource model. Okay. And the answer to that is that most clients will be able to do fine with the activation model.
Mm-hmm.
Resource model has to do with the brain spotting window of tolerance. If a person is clearly inside of it, activation is fine. If the person, you know, is has complex PTSD or even very complex PTSD, the complex PTSD, again, for the most part, is with it, as we define it in brain spotting, is within the window of tolerance, and you can use the activation model. When you start to get to very complex PTSD, which is not, you know, severely complex PTSD, which goes more to DID and severe attachment disorders, this is where you're going to start to use the resource model. You know, but doesn't have to be the full resource model. But with someone who can go outside the window of tolerance, that's where you're going to more likely explore using the body resource and the resource spot. Although it's diagnostic, because some people don't need it and some people absolutely need it.
Right.
And if somebody is clearly outside the brain spotting window of tolerance, then you know, then you have to use the resource model. In fact, you have to use the fuller resource model. Just hold on a second here. Okay. Now, dysregulation to regulation. Well, the whole idea here, that this conceptualization comes from Damir, and you have to know Damir Del Monte and reasonably know his work as we have taught it. But the basic idea is that people come in for psychotherapy in a state of dysregulation. In other words, they're not able to feel emotionally. Here's my cat coming over. Feel emotionally, somatically, or thinking-wise, or behaviorally. They're not able to feel or function in the way that they want to and need to, and they're not able to work it out on their own. And that is the definition of dysregulation behaviorally or externally. Whereas if you do a brain scan of someone who's in a state of dysregulation, you'll see that there's certain areas of the brain that are activated. Amen Clinics does this a lot, and they find the diamond configuration or the diamond plus. I may have to come here.
We're getting serenaded. That's all right.
Okay. Probably wants food.
Mm-hmm.
So the goal of all psychotherapy, but the specifically articulated goal of brain spotting, is to help bring a person from dysregulation towards regulation. Mm-hmm. And the idea is that there's a flux to it. It's not like a person just goes straight line and hits, they're able to be regulated. Everybody goes out, even once you reach a reasonable level of regulation, we always go out of it into dysregulation, but the system needs to be able to, on its own, bring a person back. Mm-hmm. And that's what's lacking for people who come for therapy, especially with dissociation-based trauma conditions. Allocortex and esocortex. The consultee does not have to be a true expert in this. They have to be able to at least show that they understand it. And when we say allocortex, we mean the granular and agranular. Granular meaning having the 5 levels with a granular layer, which is involved in higher order function. The granular esocortex, which is usually also called the neocortex or the left prefrontal cortex, is so involved in these higher order functions that it cannot be involved in regulation, ongoing regulation. That's the key factor here.
Mm-hmm.
And the agranular esocortex, the part of the esocortex that does not have a granular layer,
Mm-hmm.
is very involved in regulation, as is the esocortex, which is also known as the limbic cortex.
Mm-hmm.
Most people don't know that the limbic system has a cortex. So the whole concept here is that the goal of all successful psychotherapy should be to bypass the granular esocortex because it doesn't regulate, and to gain access to the agranular esocortex, agranular, oh wait, I got this backwards. The esocortex, it's the granular esocortex and the agranular esocortex. Scratch everything I've said so far. And the allocortex is the limbic cortex. So the goal is of brain spotting therapy, but really all therapy should be to bypass the granular esocortex to access the agranular esocortex, which has less than 5 layers, does not have a granular layer, and the allocortex. Sometimes Damir talks about the agranular esocortex and the allocortex, synonymously as part of the same thing. But it's the basic concept here that to bypass the parts of the brain, of the cortical brain that are not involved in regulation, to access the parts of the cortical brain that are.
Okay.
And going down to weight, pretty straightforward. Why am I talking? In brain spotting, like we say in the trainings, we wait, and wait some more. And when we don't know what's going on, we wait. And when we do know what's going on, we wait. Basic idea here, that this goes absolutely along with the uncertainty principle and with attunement. But what we find is that when if we don't step in, the client's process, or the head of the comet always goes to a place that it wouldn't go to otherwise, that we couldn't anticipate.
Mm-hmm.
And again, weight goes along with focused mindfulness, tail of the comet.
Mm-hmm.
Here, the consultee has to really understand, and this is going to come out in the case material presentation, whether they really are waiting enough, or whether they are jumping in and they don't even know that they're supposed to wait, or keep on waiting.
Mm-hmm.
Z-axis attachment. Well, you have Z-axis on the other side, but basically, if you go backward or further away, and the SUDS, instead of going down as it usually will, goes up, it is a diagnostic indicator of the possibility of significant attachment issues. It's not 100%, but it's interesting.
Mm-hmm.
I don't know if it's absolutely crucial enough to have this here in the theory, but it is so diagnostically significant that it might be there. So I'm not sure about that. So let's just leave it as it is. Now you get down to case conceptualization in a brain spotting frame. That's what really goes into sessions 2, 3, and 4 primarily. This is you're going to look for in their case presentations, whether they, in terms of how they describe the case and how they describe the process, whether they, all this other theory stuff and all this practice stuff, they have or not. That's why this is there. It's like one line at the end, but this is really sessions 3, 4, and 2, 3, and 4 are all about this. And here, highly recommended for their own sessions. That might be under practice instead of theory.
Right. Right. Yeah, I think I'm going to cut that. Quick question. So
yeah.
here's my thing on this, and see what you think about this. Is what if I'm just looking at the time frame and also the content of everything that we've covered so far.
Yeah.
What if we do this as video 1 and then come back and do another time where you and I can get together and then we just discuss practice separately. What do you think of that idea?
I think that's a good idea.
Yeah. Yeah.
I think you have enough from me right now to even show the consultees.
Yep. Yeah. It's already an hour. So
Yeah.
this will be good to just get them started about how to get started. And then we'll do a second video that shows the practice piece of that.
So really, so you show the 2 videos at 2 separate times.
That's right. Yeah. Because, I mean, as we're evolving here and what we're doing, you know, I'm sure it's going to bring up discussion and so very rich discussion. And I'm meeting with them once a month for an hour and a half.
Mm-hmm.
So right there, that would take up all of theory in the beginning of it, and plus questions that they have about it. So
yeah, I think that makes a lot of sense.
Yeah. Okay. Well, great. I really, really appreciate you taking the time to come through this. I've learned a lot from today. And what I will also do once we get the 2 videos done is I will send this out to all the trainers, the US and Canada trainers, because primarily we're the ones that went through and created this report. And this is going to give us all more focus and more clarity about what we're doing in our sessions. And not that it's all going to be the same, but more clarity that we're in the spirit of what we're doing here, that we're covering the same material, you know, in our 5 sessions. So this is fantastic.
Great. Well, I thank you for making this happen. You know,
yeah, this is awesome. I'm excited about where this is going to go and where this is going to take all of us and where it can grow. So, all right, I'm going to stop our video recording here.
Yeah.